person has not been introduced, and she is Dr. Viswas, who is going to play a very important role as a chronographer today.
So good afternoon, everyone. At the outset, I'd like to thank my dear friend, Dr. Sudipta, for this opportunity, and I'm extra glad that I'm walking hand in hand with my dear friend Nishant. So here I go without wasting much time. So what is monovision? I guess I thought there might be few PGs, so just basically it is the adjustment for one eye for near and the other eye for distance. And so this is what was, just one second. So as you see that if you focus on the, with one eye you are focusing the trees and the bungalows, and with for the near vision if you are focusing the child, so you together you get a crisp vision with both your eyes. So pseudophakic monovision, we are all talking about post-operative things, and here we are all cataract surgeons. Doing pseudophakic is a type of monovision used to create the post-operative presbyopia by programmed refractive error from biometric calculations. So perfection is expected by many, and more so by our patients. Every time we try to do good surgery, but the expectations of our patients are more and beyond. And in our quest to achieve all that, we've gone from being just phaco or surgeons to phaco-refractive surgeons, giving the optimal vision to our patients. And they demand spectacle-free post-operatively. So can this be achieved? So I'm here a proponent of an SICS and a monofocal lenses. So is it possible? Yeah, let's find out. So the selection of the patient is more important. As being a professor, I have to tell my PGs also. So initially, which patients you have to select for your first cataract, and also for your first SICS and for your phacos. So selection of patient is very important. So also for this theme, because patients have to understand that some visual functions like stereopsis and contrast sensitivity and visual fields can be reduced if you focus on one eye, and for distance, and one eye for the near. So demerits of multifocal IOLs like decreased accommodative capacity, increased glares and halos, and night vision can be a problem with few patients who do not adjust to multifocals. So surgeons often select patients who not only have a strong desire to be free of glasses after surgery, but also fully understand that monovision design and its drawbacks. So here, if you have another eye, good pseudophakia with distant vision clarity, and what do you exclude? A strong ocular dominance. Those who are more than 60, I would say is 70 plus, people with small pupillary diameter, corneal astigmatism more than 1.5. So don't do that, and those who desire that to have a totally spectacle-free vision. So what is traditional in where the dominant eye is corrected for the distance, but it can be a cross monovision when there is a design called as the dominant eye is corrected for the near vision and the non-dominated is for the distance. And hybrid monovision is when we implant an monofocal IOL in the dominant eye and a diffractive multifocal in a non-dominant eye. So just a few words about SICS. The wound construction is very important, and I would, for lack of, yes, so this is a smart SICS technique popularized by Dr. Rajiv Raut, where without the, just because of the proper, this is K2K, that is keratometer to kappa reading. With this, we have an exact, we are aware of where to make the exact incision so that there is, and the proper capsule rhexis is needed, and then because of the proper incision which is guided by the keratometry. So I'll skip this. So to conclude things which seem, so with the monofocal IOLs also, it is possible for a patient to have a spectacle-free and good, great distant vision as well as great near vision as well. So things, with the help of monofocal IOLs, we can be spectacle free. Thank you so much. Just the last slide that, okay, so you, with the graying of hair also, it's not necessary that you have used lot of specs.